Hello, sorors. I am so excited to join you guys virtually during your programs week. I'm Dr. Tania. I am a board certified internal medicine hospital specialist, and I currently work in Houston, Texas, where I am actually taking care of coronavirus patients. I do appreciate you guys giving me the opportunity to answer some of your questions, so let's just get right into it, huh? When COVID-19 first arrived in the US, masks were not required nor considered helpful. How are they beneficial now? So I think at the beginning, we didn't quite understand that there was such a large population of people who were what we call asymptomatic carriers, okay? So in the beginning, we didn't recommend that the general public wear masks. However, lately, or more recently, we've discovered that there are a number of people who are asymptomatic carriers, meaning they have coronavirus and can spread coronavirus, but they don't have symptoms. So they wouldn't know that they were sick, and they could go out into public and unknowingly spread the virus to other people. This is why we recommend that the general public wear masks, protect you from spreading coronavirus in the event that you happen to be one of those people that has the virus and can spread the virus but does not have symptoms. So that's why that particular recommendation changed. The next question says, what are some ways we can prevent the spread of COVID-19 other than social distancing? Now, I want to be very clear. Coronavirus is spread through human-to-human contact. So the only way to allow this virus to die out is by limiting or minimizing or eliminating human-to-human contact, which is why we request that you guys stay at home and implement social distancing, okay? I understand it's difficult, I understand it's frustrating, I understand it gets boring, all those things, but you have to understand that the purpose of you remaining socially distant is to starve this virus so that it dies and so that we can go back to our normal lives sooner rather than later, and also so that we can minimize the loss of life from this disease, okay? The other things that you can do in the event that you have to go out into the public, you can wear a mask to, again, reduce the spread of coronavirus from asymptomatic people who are carriers to susceptible people who can possibly become very ill from the disease. You should also try to stick to social distancing techniques. Even though you're actually out in public with other people, you need to remain 6 feet away from the next person. The other thing you should do is wash your hands frequently, because you're touching surfaces constantly when you're out in public, and you can touch a surface that's been contaminated with a coronavirus and later infect yourself. So you just want to wash your hands frequently. I don't recommend that you try to wear gloves to protect yourself, because gloves only gives you a false sense of security. The reason is you touch contaminated surfaces with the gloves and you think you're protecting yourself, but then after that you go and touch your phone, or you go touch your car handle, or you go touch your steering wheel, and you haven't washed the outside of the gloves. So you end up basically contaminating other surfaces that you're going to touch later with your bare hands. And that's a great way for you to contract coronavirus. So don't wear gloves. Just make sure you wash your hands frequently. Wipe your cell phone down with disinfectant frequently. You probably even want to wipe your steering wheel and door handles. Common surfaces you want to wipe with a disinfectant wipe or Lysol or some other cleaner. What does the virus internally infect, and how likely is it to fully recover from it? So the virus actually is a respiratory virus. So it infects your upper airway, your nose and your throat, and it can also infect the lower airway, your lungs. So the way it goes into the body is via the eyes, the nose, or the mouth. And it can cause mild symptoms such as runny nose or sore throat, in addition to fever, or it can cause severe symptoms if it gets into the lungs. It can cause shortness of breath, it can cause coughing, it can also cause respiratory failure, which is a severe condition where you are not able to get oxygen into your lungs and into your blood, and you have to have a ventilator or be put on a breathing tube, okay? Now, the majority of people who get coronavirus, somewhere around 80 or 90%, will actually recover and do fine. Now that number is just an estimate at this point because we don't have a full scope of how many people have actually been infected with the virus. So, again, that number is just an estimate. We'll know better after this has kind of run its course and we have data to look at from the back end. But again, these 80 to 90% of people who get the virus will actually recover and do just fine. And there's a large population of people who actually won't have symptoms at all. Now, there's a small population of people who actually will require hospital admission, and even those people can actually, I've seen several of them recover and clear the virus and go home, even though they had to be hospitalized. So there is a group of people, a smaller group of people who actually require an ICU or intensive care unit admission, and even smaller population of them have to be placed on a ventilator. And some of those people have recovered and gone home, been discharged from the hospital, but some of those people have actually not recovered at all. They're still fighting for their lives, or some of them sadly have actually died in spite of our best efforts to support them through their viral illness. Unfortunately, there's no medication at this point to cure or clear coronavirus. So really, everything that's been mentioned in the media is still being studied for safety and effectiveness. So there's nothing that's been FDA approved to treat it. So we're still working on that. We're also still working on a vaccine to prevent coronavirus in people who haven't been infected with it or don't know that they've been infected. It would be to basically try to protect the rest of the population from getting the coronavirus, and hopefully soon, with the measures that we've implemented so far, such as the stay-at-home orders and such, the coronavirus will die down and we will hopefully be able to get back to our normal lives soon. Let's see. If tested positive for the virus, what are some home remedies or self-care activities we can do to increase chances of a full recovery? So the best thing you can do is to prep your immune system before you get the virus. And the way you prep your immune system is by eating a nutritious diet of whole foods, including whole fruits and vegetables, and unprocessed meats and grains. That's the best way for you to make sure that your immune system has all the nutrients that it needs to fight off the virus. Another thing you need to do is you need to sleep, because sleep deprivation has actually been proven to suppress our immune function. So you need to sleep at least 7 to 8 hours a day. Then you need to remain physically active. 150 minutes of physical activity every week is what's currently recommended. And those things all help your immune function as well. In addition to limiting alcohol intake and avoiding smoking altogether, because we know too much alcohol and smoking can actually suppress your immune system. So that's how you prevent, or you set your immune system up to fight the infection the best it can in the event that you do get infected. And if you do test positive, the one thing you can do to try to kind of help, there's nothing necessarily to speed up or sort of help you fight off infection. So you can take a vitamin C supplement. You can also take a zinc supplement. But beyond that, you need to make sure you're drinking enough water, at least 64 ounces a day. You need to make sure that you are resting and letting your body heal. You need to make sure you're getting enough sleep so that your body is able to heal. So those are the three main things that you can do to try to support your immune system during the coronavirus infection if you actually do test positive. You should also try to protect your household contacts or people that live at the house with you by washing your hands frequently, sanitizing surfaces, using a separate bathroom. That's the way you reduce the spread of the disease, among your household contacts. Oh, but one thing that I do want to mention, there are no FDA-approved treatments for coronavirus at this time. So there's no medication or drug that you can get your hands on. You might hear about things in the media talking about different medications, but those have not been proven to be effective against coronavirus, nor have they been proven safe to be used in coronavirus infections. So there is nothing at this point that is FDA approved as effective or safe to treat coronavirus. So there's no medication that you can get your hands on to help you clear the disease faster or anything like that. So just keep that in mind. What activities are you doing to stay busy during quarantine? So during quarantine, I'm still working. I still work 3 12-hour shifts every week in the hospital. I also do telemedicine a few hours a week at home, basically. And other than that, I try to make sure I'm eating at least 4 to 5 fruits or vegetables every single day to make sure that my immune system is at tip-top shape. And then also I exercise regularly. I run 3 to 4 days a week, and I also do exercises from home 2 to 3 days a week in addition to my running. So I'm making sure that I'm sleeping enough, eating well, and exercising. So those are the biggest things. And then also, I'm spending a lot more time with my family, and I'm actually doing a little more on social media. So I have an Instagram account at Dr. Tania. It's at doctor.tania. I also started a TikTok account, and I'm really a lot more silly over there, just kind of having fun. So you can check me out on those platforms. If you have any questions, please feel free to reach out to me. I usually respond to direct messages on Instagram. Thank you guys. I hope you have a great rest of your week. I know that they've been working hard to put programs together for you guys, and I hope that you guys are able to enjoy it in spite of being socially distant. Thanks.